Welcome to today's edition of Mental Health Matters. Today we're going to be talking about the services that Cal Voices have to offer the community. I have Stephanie Ramos on the show today, who's the communications director, and she's going to give us a brief outlook on what Cal Voices have to offer. Get you something to drink, get you a snack, and come on back.
Oh, thanks,
Stephanie.
Jesse. I love your intro.
Welcome to our show.
Thank you.
Yes. So how's it been going?
It's been going good. Lots
Good.
of changes, but lots of good changes. And hopefully, I think everybody's getting back into the world and back kind of integrated back now. And that COVID is hopefully improving. So
Yeah.
we'll see.
It's been hard with COVID, but we've mustered through. So let's start off by you just telling us a little bit about who you are and how long you've been with the organization, and just go from there.
Got it. So like Jesse said, my name is Stephanie Ramos. I have been at Cal Voices for about 15 years, and I've worked in different roles. So I started as a youth advocate, working with youth in the mental health system, and then I've supervised peer-type programs. I've worked in our training programs, our advocacy programs, and now I'm fortunate enough to be in our communications director role, where I get to do quite a few things. And I mean, I've worked in this field for a while now, and part of it is because I have a sibling who at times has severe mental health challenges. And, you know, I like to think that I'm really connected.
Yeah.
So I know people who are in charge of programs. I know people who are in charge of departments. And even being that connected, we run into challenges and barriers all the time in her accessing services. And so for me, as much as sometimes I kind of want to step away from this field, because I always tell people this is like heart work that we do. It's hard work, but it's heart work.
Yes.
I realize that there's a lot of people out there that, you know, what happens for them when they don't have that access to the people who are making decisions or who can make a change for them. And it's like, if we're going through that still, like, what are they experiencing when they're trying to get help?
That's absolutely correct. And I like how you kind of talked about, you know, your sister a little bit, because I too have family members, a brother who deals with mental challenges, depression, anxiety, and schizophrenic disorder. And what I've done through the years, I've taken all the education and information I've learned from working at Cal Voices and just going to the different meetings, the different training and workshop, and I give those tools to him or my mom, and just really trying to bring them up to speed of what's going on. As you know, there's a stigma attached to mental health, and a lot of times people don't want to necessarily deal with what's on the table, but what's on the table, if you don't deal with it, it hurts the person that's been affected by it, you know. So.
Yeah, and like a hard thing is that it's like we don't know what we don't know, right? So I'm going to talk about SacMap today, but part of developing that was we realized like there's a lot of people, there's a lot of services, but if you don't know about the service, like you don't know what to look for, you don't know how to find it, you don't know that it even exists. And so even though there might be resources out there, if people don't know about them, like how useful are they really? Yeah.
So do you feel like you got involved as a youth advocate because your sister, or a combination of both, your sister and you had a passion for this field?
Well, I think the universe brought me here.
Okay.
So I actually went to a placement meeting for my sister when I was about 18, 19, and my parents are from different cultures.
Yeah.
And so I had a feeling like they may conflict in that meeting as far as what they want, what they think should happen. I knew that there was going to be a doctor there and a social worker there, and being the oldest and as far as like the kids in the house, and knowing my parents, I just had a feeling that meeting might not go very well. Yeah. And so I asked if I could go, and my mom was like, of course you could go. Yeah. And I ended up being the mediator in the meeting, explaining to my family what the treatment team was trying to say, explaining to the treatment team what my parents were experiencing and what they were trying to say. And someone followed me out and tapped me on the shoulder and was like, you know, you could get a job doing this. I was like, oh, really? Yeah. So that's why I kind of feel like I wouldn't have this job without my sibling, and I wouldn't have this job without having that opportunity to like go and attend. And then I just happened to be in the right place at the right time. So it kind of like say it found me, and then it just kind of took off from there.
Very nice. I know I've had previous roles in other nonprofit organizations. But this is by far the most, this job or this agency has definitely added to my education as far as mental health is concerned. I thought I knew a lot, but obviously, you know, just working for Cal Voices, so many services that target so many populations. So it really did help me out, and just it also helped me to be able to educate other people outside of work as well. So I'm really grateful. Shout out to Susan Gallagher, our executive director, who, oh my gosh, she's been doing it a long time, and she's put in her heart, sacrificed a lot to, you know, make these programs work. You was part of the grant writing. If you're not still part of it, Danielle, all you guys just make all this stuff work. So I personally appreciate all the work that you guys are doing.
Thank you. I appreciate it.
So let's talk a little bit about the services, Cal Voices. So tell us a little bit about Cal Voices and the services that's offered.
Okay, so your viewers might have heard a little bit about us before, because I'm sure we've had other programs come, but Cal Voices really kind of has three primary service type programs that we have, and that is peer support, advocacy, and training and education. And so our peer support services are where we hire individuals who they themselves are living in recovery, or they're a family member like myself. And we're working with youth, parents, family members of adults, older adults, and having staff that have that experience to help those other people who are seeking help to really navigate services, to be active members of their treatment teams, to find out what's available for them, and kind of helping them to figure out, like, what are the resources available for me so I can get me and my family's needs met.
Yes.
And so in our advocacy programs, we have a program called Access California, and they do advocacy statewide at the local and state level, where they're really trying to put the consumer voice first.
Yes.
So the voice of the individuals who are service recipients, who are needing services, and making sure that their voice is at all the tables where decisions are being made, whether it be within a county and, you know, a specific county within a region, or statewide. I know right now they're working on some criminal justice and behavior health type projects, and
Nice.
so that's a great opportunity, I think, for folks to get involved if they're interested in advocating for the mental health needs of themselves or behalf of those who are, you know, struggling with mental health. And then our training and education programs really focus on peer support. So we have a program called WISE, or folks might have heard of it as WISE
Yeah.
University, where we provide a 80-hour peer training and placement program. So we bring folks in who have that lived experience of recovery or their family member, and we give them a foundational training on what is peer support, how do you do it in a way that's evidence-based, and then we also provide training and technical assistance to their employers.
Yeah.
To counties, to agencies that hire them, because sometimes we bring in a role and we want the system to change and we want them to understand this new role and bring it in. But if we're not really educating the people who are supervising them, managing them, determining wages, who are their coworkers, then it's kind of, you know, we see that sometimes it's not as successful.
Yes.
So we're able to kind of provide that full service, not only training, but training for the line staff, and then also all the way up to the supervisors, managers, leaders of organizations. So
Yes.
I think those are kind of the big three categories as far as the types of services that we provide.
I think it's important that, well, first let me back. I love the fact that the agency is taking the services out of Cal Voices, because it's important that the employers get educated as well when they hire employees who may have a mental health diagnosis. I know myself, I've worked at jobs where employers may not have been as educated, and so I was able to kind of navigate that situation and bring light onto why this person may be missing days, or why this person may need extra breaks or whatever, because a lot of them, they really don't know. Like you said, you don't know what you don't know. So I think that's important. And I think even with police officers as well, getting that training when they're going out there and seeing people who may be homeless or have a diagnosis with being homeless, and they know how to approach the person instead of just automatically, you know, treating them a certain way. You have to be very careful and treat people like people, but at the same time understand that, you know, they may be in a situation right now, you know. Right. Something may be triggering them, and, you know, so just to be able to understand the full scope of it is really important. in my opinion.
Yeah, and I mean, mental health doesn't discriminate, right? So
Right.
it's not just the people that they're responding to, but it could be their colleagues, their
Yes.
coworkers, other officers, other firefighters, other first responders that might be in the field that are exposed to trauma regularly, who have high stressful jobs,
Yes.
who have, in addition to that, stuff going on at home. And
Yes.
so I think recognizing it's not always like our client or the people we serve, but it could be our coworkers, our neighbors, our friends, our family members, anybody. Right?
Yes, absolutely. I know, you know, I know it's kind of off topic, but I'm just talking about my brother a little bit. I know when I was, when I started being more educated, when I started working here about mental health and stuff, and I talked to my mom and I asked her, I was like, Mom, like, why didn't you get my brother no help? And her response to me was because I was ashamed of what the family and friends would think about me and him. So all these years he suffered, but luckily I was able to. One day I went to Chicago. I had a conversation with him, but he wasn't ready yet because he had was thinking about what people think about him. But then I would call him and call him and call him, and finally he went to get the support and help he needed, and he's doing okay now.
Well, and to that point, I think it's important for people to remember that just because someone has a mental health challenge or an illness, a diagnosis, any of those things, it is not a life sentence, right? Recovery is real. People can and do get better. There are studies around it. People, even with severe mental illness, can and do get better. For some people, even without medication, right? And I'm not pro or against medication because my sister really needs it. But everybody's recovery journey looks different. And so for some folks, recovery is a process that they're always on, that they're always working on daily to stay in recovery. For other people, it's a destination, right? It's somewhere that they're going to get to. And so recovery means different things to different people. And so we can't take what we see or think of as recovery and say, oh, you're not recovered yet. Because that might not look the same for that person. And I think what happens a lot is that when we talk about disabilities, mental illness is sometimes a disability that you don't see.
Yes, absolutely.
So, and a lot of us only think of mental health as a disability when we can see it. When someone is having a severe mental illness, when they're homeless, when they're acting out in the street, like that's what we think of mental illness. Because that's what we see. But there's so much like people that are in distress, who have depression, who have anxiety, that are going to work every day, that are taking care of their kids, that are, their life is still going on and they are sometimes struggling. And the shame comes into place. I don't want to tell somebody because they might take my kids. I don't want to tell somebody because they might think I'm not a fit parent. I don't want to tell somebody that my kid's struggling because they're going to put a label on them. Or they're not going to be able to get a job later because they put this label on them. And so there's this fear and this stigma and this shame around mental illness. And so people really live in the dark with that illness, right? And so I think something that, and then we assume that mental illness is just what we see. And it's not. It's everyday people, right? We know that like 50% of individuals in their lifetime are going to have a mental health condition. And if we were in person with a big room, I'd be like, look to your left and look to your right. It could be you, right? So it's huge, right? And we know that there's a smaller portion, 1 in 25 individuals, who might actually have a severe mental illness. Right? And that's like schizophrenia, severe depression, bipolar. So it's very common. But it's just starting to become a more common thing that we're talking about, and especially with our younger people, right? They're having a lot of courage and talking about issues that older generations maybe kind of had that shame and that stigma and weren't ready to talk about. But that recovery piece is essential. And I think along with that is sometimes we talk about mental illness in a way that's shameful, and we don't talk about mental health. Right? And sometimes people assume that poor mental health and mental illness are the same thing, and they're not. Right? So I could have a diagnosed mental health condition where I have periods of times where I'm unwell, and then I could have periods of time where I'm doing great, and then maybe I have another episode later. I could also not be diagnosed with a mental health condition at all, and at times have poor mental health because of stress that's going on. I'm not doing my self-care. Maybe I don't have time to because all the pressures and responsibilities that I have. So it's not that, oh, I don't have a mental illness, I don't need to think about my mental health. Right? We all have mental health. It's a continuum, and thinking about where am I on that continuum right now, and how do I keep myself on the side of the continuum where we think of wellness, right? And where I can like really persevere and achieve, like be in a place where I'm like not feeling that stress and anxiety, but recognizing it's right there, right?
Yes.
It could happen tomorrow. It could be,
Yes.
It doesn't have to be a diagnosed condition. You
Yeah.
can have poor mental health. So
Yeah.
I think the more we normalize those conversations, the more we can start to talk about recovery and that people don't get stuck and aren't always in this place of mental illness.
Yeah, that's so important, what you just shared, because I know I've had a good friend who, but I wasn't aware at the time back then, but he would always say, oh, I'm battling a down feeling. What he was telling me was he was dealing with depression, and he would just go into like this deep depression state, but I wasn't as educated as I am now about it. Mm-hmm. And so once I started working for Cal Voices and started getting educated, going to these trainings and workshops and stuff, then I was able to assist him. It was like, okay, you're dealing with depression. How do you feel? Ask him questions. And sometimes he was suicidal. Then I learned to take that stuff obviously more serious and just kind of provide him support that he wasn't necessarily getting because he was from another culture. And in that culture, it was like, no, you man up and stuff like that.
Well, and I think a barrier sometimes is that when we talk about recovery is that sometimes we only focus on the mental health part.
Yeah.
And recovery is much bigger than that.
Yeah.
Right? What about our spiritual health, our physical health? We know that chronic health conditions contribute or are a risk factor for somebody developing a mental health condition.
Yes.
Right? We know that social isolation can put someone at risk for developing a mental health condition. So we have a coworker who goes out on leave because they broke their leg or they got in a car accident or have a physical health condition, and they can end up developing depression because of the social isolation, right?
Absolutely.
And we don't think about all of the, in a way, even though we have work stress, right? And work stress can put us at risk. It can also be a protective factor because going to work gives me opportunity to contribute, purpose. It gives me routine and structure, and it gives me social interaction, right? I'm having people that I'm engaging with. And so that, recovery is more than just the mental health condition. Mm-hmm. And SAMHSA's, the Substance Abuse and Mental Health Services Administration, in 2012 came out with a working definition of recovery because everybody for years is saying, oh, we're doing recovery around mental health, but we didn't all have the same definition of what does that actually mean. Yeah. And if I can remember right, SAMHSA's definition is that recovery is a process of change through which individuals live a self-directed life, live a self-directed life, improve their health and wellness, and strive to reach their full potential. And their definition says improve their health and wellness. It does not say mental health. Yeah. Right? So when we're thinking about people in recovery, or we're thinking about how can I support someone who's having a mental health condition, we don't always have to focus on the mental health part.
Right, exactly.
Right? How is what's going on in their other aspects of their life? Looking at social determinants of health, looking at other aspects in their life that could be contributing to their mental health challenges.
Absolutely.
So if you want to support someone, it doesn't have to always be like, oh, the depression.
Yes.
It could be like, do you want to hang out?
Yes.
Do you need to get out of the house?
Exactly.
Right? How's your physical health doing? Do you want to go on a walk? Like there's lots of things that we can do to be a support.
As you were talking, that kind of remind me of another service that's often in Cal Voice, and that's the RAP workshop, which is Wellness Recovery Action Plan. And obviously they teach a lot of things in there to how to get well and stay well. And they have a section where you have supporters and you have to do what you call it, the plan. I'm trying to blank
daily
it.
Maintenance plan.
The daily maintenance plan. It's just different. It's such a phenomenal workshop. And it's for anybody. You don't have to have a mental diagnosis. It's for anybody that want to kind of just get back on track. And you get this binder, and you can always go back. And it's a really good service and stuff. So it just kind of brought to mind when you were talking about recovery.
Absolutely.
Yeah, we both facilitated. You was facilitated.
Yes.
Yeah.
It's been a while.
Yeah, you was. Okay. So let's talk a little bit about the SacMap program.
Yes.
What does it have to offer?
So the SacMap program came out of a conversation with a lot of people, but the cool thing about this project is a lot of times when you apply for a grant, they say, we want you to provide this service. Tell us how you're going to do it. And with this grant opportunity, they basically said, we have this much money. Tell us your idea. Right. Nice. So SacMap is funded through Sacramento County's Division of Behavioral Health, and it's administered through Cal Mesa. And the design that we came up was to figure out how do we capture all of the behavioral health services funded by the county and put them in one place.
Nice.
Because I don't know about you, but if you've ever tried to go to any county's behavioral health website and find services, they have a few things, but you only know what you can find. Right? And if you're Googling and you don't know a service exists, you're not going to Google it.
Correct.
So even like me being well connected with the system and my other colleague that I'm working with, we were searching for resources, and there were so many more resources than either of us even knew existed.
Wow.
Like I always hear people say, oh, there's not a lot of mental health services. Now that's probably true. There's probably a limited number on how many like mental health professionals like our therapists and clinicians and things like that. But as far as like preventative services or other services people can take advantage of, there are a lot out there, and we didn't even realize it. And so for us, one of the gaps was in the system was that there was no one place to go to find out what's in the system. And so kind of going back to what I said earlier, like if you don't know what's out there available to you, how do you access it? So the SacMap project is really intended to reduce any prolonged suffering in folks. Like, how do we make it easy for you to find a service, get that information, and access it? Like, how do we make it easy for you to do that? And there's some services in the county that like you have to call a certain number, you have to get an assessment, you have to go through a process, which is important for a lot of people, that specific service. But we try to focus on services that anybody can call. You don't need a special assessment, you don't need special insurance, anybody can call it and you can go and get support through those programs. And so we created our program, we called it SacMap, so that folks can, this is our nice little map to find out your services. And like I said, we tried to get, it's primarily mental health services funded by the county. We did add some other services on there as well, but we tried to find things that anybody can go and access regardless of their insurance coverage. And so in addition to the website itself that folks can navigate, we also provide monthly workshops online where we talk about recovery, kind of how we did in the beginning. We talk about mental health. We tell people, what do these types of services mean? Because someone might say, oh, we provide respite. Well, what does respite mean? Right? So we tell people like, well, you know, it's a safe space where you can kind of get away from your environment, reduce your stress, get linkage to resources, connect with people. And then we'll give people some examples of like, here's some programs that do that and here's what it looks like. So we do a little better about a recovery. We tell people, what do these services actually mean? And then we give them a website tour. So when folks go to the website, everything's familiar, right? Like, oh, I know they clicked on that button and it took them to this information. And so the cool thing about the workshops is that if folks are interested in attending, we also provide a $25 gift card for their participation. If they register, attend the workshop, and fill out our workshop evaluation at the end. And people are like, I have to fill out the evaluation. And I say, absolutely, because that's how we make the program better. So you just do those things, and then we send you out a gift card.
How long is the workshop?
They're 2 hours.
2 hours, okay.
So they're a little long, but I like to think that we keep it entertaining enough that you can get through those 2 hours.
Okay, so once a month, 2 hours, they fill out the survey, attend, and they get $25.
Yep.
I think that's a good deal.
I'm just saying.
I think that's a good deal. Generally, what time is the workshop?
They're usually on the third Tuesday from 10 to 12.
Okay, 10 to 12. Okay.
Yeah, and we have that information on our website as well for folks to check out. All
right, I'm gonna see if I can get some people signed up because I think it's a good resource. I went and did a little bit of research, and SacMap, they provide services. I like how they had it in different categories, like the older adults, and the children. Like, it was just so well put together. I was like, oh, so I got to click in and start reading what they do for adults and so forth. And so really, really, really good. Yeah, and on the website, we really tried to, the nice thing is that my coworker and I both have gotten very well versed in the website development program that we use, software, I don't know, but we've both gotten pretty good at it. And so we were able to build the site ourselves. And as we were building it, I'm thinking, like, if this was my like aunt or my sister, or like, how can we make this super user friendly so that it's not like I have to click on 6 different things to get to the list that I need? Because I think that's, if I'm struggling and I'm going through it, or I'm stressed for my loved one, and now I have to navigate this website that is like not user friendly, I don't know what to click on, I don't know how to get back to where I was. Like, I don't want to create more stress for someone trying to find the resource. And so, kind of like you mentioned, we have it set at, the first thing we did actually was recognize that if someone's looking for help for a crisis, you don't want to go through a big old list of mental health services. So we actually
in addition to it being in the lists, we made a crisis section. So when you go to the page, you can click on crisis and it'll take you to a whole new page where it gives you categories. Do you want phone crisis support? Do you want respite crisis support? Do you want direct crisis support? And you can click on there and it'll show you the different resources available for you that you can reach out to. So that was the first thing, is like, we want to make crisis resources super easy for people to get to. And then we did the age groups, right? So we have a page for children, youth, and young adults. And we just added children's resources to that page. We have a section for adults, just generally. And then we have a section for older adults. And so for the young adult, children, youth section, and the older adult section, we pulled out programs that are specifically designed for those age groups. So that doesn't mean that they can't access the other services on the adult page. But if somebody's like, I want a service for me, for my age group, people to get me, then they can go to those two sections of the site and get a list there. We also included some other resources there that we thought that they should know about. So if somebody only goes to the youth page, they should know about the mental health urgent care, even though it wasn't specifically designed for them, right? That's an important resource for them to know. And so we did kind of things like that on the age groups, just so that folks didn't miss out on something that we thought was really important. And then most recently, we added a diverse communities page. So originally, when we created the resource pages, we created categories for types of service. So crisis services, respite services, phone services. We made like little links so someone could just click there and it'll take them to those types of services. And we had created an LGBTQ section. And then we started to think like, well, what about other communities, right? How do we give them a unique section? And we recognize that even though there are a lot of programs for diverse communities, there aren't a lot of programs for specific communities. So for the Black African-American community, there's not a ton of services, mental health services. So we didn't want to say, here's your section and have 2 or 3 services. So we took out the LGBTQ section and we made a section, it's a button just for diverse communities. So you go to the front page, you'll see the crisis button area, you'll see the sections for age groups, and then there's a diverse community one. So folks can go there and check out all the services that are uniquely designed for the different diverse communities here in Sacramento. So we're working on it. And we're actually working on adding a page for substance use treatment and prevention. So that's kind of our next section. It's been, I mean, it's more resources than we thought. So it has been very time consuming to add it all, but we're starting to recognize there's needs for this other information. And we don't want to turn into 2-in-1, because that is like overwhelming to even think of doing. But if we can get kind of if we expand our definition to behavioral health, making sure that we're including that mental health and substance use piece.
This is very impressive to me. Like, I'm serious. Like, I didn't go into a lot of the other spaces on the website, but I touched on enough to know, like, oh, okay, this is very, useful. How was that experience for you developing all this? Like, because I know it took a lot of it took a lot of time. But how was that?
Well, developing websites and designing them is kind of fun. Like, it's like put a beautiful puzzle together. But it was very time consuming because just like everybody else, we don't know what we don't know. And so we are constantly trying to find like updated lists of resources, like Googling certain terms, just trying to find like what is available within the community and what is available that you don't need like a formal referral for. Because we don't want somebody to, like, for example, like there's outpatient providers in Sacramento. And in order to get an outpatient service, you need to call the access team. And then the access team does an assessment. They decide, are you eligible for services? Do you meet medical necessity? Do you have the right insurance? And then if all of that checks out, then they assign you to a provider, and then the provider calls you. But if we listed those outpatient services on the website, then people are going to call the outpatient provider, and the outpatient provider is going to say, no, you need to call access. And we were trying to avoid that from happening. And so all of our sections will list programs, but if you get to the outpatient section, it's going to say, wait, here's what you need to do to get to those services, rather than telling people, here's the places you can go. And so for us, it was... I think it was a learning experience because we learned about a lot of resources that we didn't know were available before, but also it was, we were constantly changing things because we would create something a certain way and then go back and think about it and be like, wait, is this going to be confusing for the end user? Like the person who's using it, does this make sense? Do we need to change how we formatted it? Do we need to move things so it's easier to access? So, it has been a labor of love, and thank goodness I have somebody else I'm working on this project with.
Yes.
Because and it's not just it's not just finding the information, but then it's adding it, and then we have to keep it updated.
Yeah. Oh my God. Yeah. That's
so this isn't over yet. Once the website's done, the next thing will be like, now let's call all these places again to see like, do we have the right information? Because we don't want somebody to come and get a resource and find out it doesn't exist anymore, the number's wrong. We really don't want folks to run into that when they're out there literally trying to seek help.
So you or Nicole, either one, just kind of make sure that the information is updated, correct, and okay.
Yeah, we made a nice survey to send out to providers to say,
really
hey,
good.
Check out our page. You're on it. Let us know if we need to change anything.
That's good.
It's a lot, and so we're hoping that this can continue.
Yeah.
But we're definitely trying to make it as user friendly and accurate for the community.
So how long has this particular program been with Cal Voices?
So I believe we've had this program since June or July of 2020. Okay. So it's pretty new.
Yeah.
And it's not done yet. I mean, it's still a work in progress. We were able to get all the information on the site, and again, we're always adding things. So we designed it, we're adding information, we're constantly making updates, and we actually just added translation recently. So if you were to go to the website, you go to the top right corner, there's a little drop down arrow, and I think we have 5 or 6 languages available, and it's not perfect. I will say that for sure. I think that's one of the big things we're working on now is, once you get the initial translation done, then we need to go back, work with folks to make sure that translation is right, and going in and making sure that we're making those updates. So the translation is not all there yet.
That's all right.
We're hoping that as we are able to kind of go forward with the project, that we're getting those experts in there and making sure that we have that right.
Nice.
And then another feature that we added was a kind of filtering tool. So we recognize that a giant list of resources could be very overwhelming for people, and so we worked with a web developer, because this was beyond our website expertise, to develop a filtering tool. So like if I go on a shopping site and I want to buy shoes in a size 8 that are blue, I can put those filters in and it'll give me a list. So we created a filtering tool for services, so folks can pick their age group, their language, their cultural group, or some type of group that they might belong to, and then they're able to filter, and it will show them, here's a list of organizations that serve those different options that you picked. The more filters, the less options you get. But that again is a work in progress. So we're constantly adding tags to the different agencies and resources to make sure that the right things pop up when folks are able to put in those filters.
Nice. So are you guys able to monitor the traffic that's being?
Yes.
Okay, good. Yeah. That's really good.
That's something that we just started doing in the last quarter, is trying to see how many clicks we're getting and things like that. And it's more than what I thought it would be. So it's getting more popular and it's getting out there. And we're really just trying to, we're trying to get this information out there because people need it. Yeah. And I don't know any other place that folks can go to one place and get all that information. It is hard to find. It's hard to find resources, but it's hard to find stuff you don't even know to look for. Yeah.
And anybody can access this, the website, and also do the services cost, or is it free? Or
so the SacMap site and the workshops, we're not charging anybody for that, but most of the providers we put on the site are free.
Okay.
There's some that are sliding scale or low cost or no cost.
Okay, good.
But most of them are free services, and that's why we really focused on programs funded through the county, because once you start to go to like private programs, then they start to charge fees, which I think can be really valuable for a lot of people, but also recognizing a lot of people don't have the extra money to go and do that. And healthcare in general, especially like mental health care, and then specialty mental health care, and then all these special programs can get real pricey if we're talking about like private providers. And so we try to really focus on services that can be as free as possible for our community members.
Nice. Do you find that during the COVID, especially during like the beginning of COVID, when you guys actually started the SacMap program, do you feel like a lot of people is utilizing the service a little bit more?
So yes. So we've seen an increase, and we're seeing an increase in traffic on our site. And COVID totally changed our program design, because when we started the program, when we designed the program, so we designed it before COVID hit.
Oh, wow.
We were going to be doing in-person trainings.
Yeah.
We were going to have printed resource guides we were going to hand out at trainings.
Yeah.
And then COVID hit, and it's like, we can't have in-person workshops.
Yeah.
So we moved all of our workshops to Zoom.
Yeah.
And then we decided, instead of having printable guides, and also printable guides that are gonna like, they'll be out of date at some point.
Yes.
Let's make a website with all the resources instead.
Yes.
And so that's what we did. We really moved to the online format. And then what we're doing in lieu of the printable guide is we have the online resource guide, and we're actually creating a printable one. So folks can download it and print it.
Yeah,
and then
nice.
we, on our end, can make sure that we're updating it as we update the website. And we don't have to worry about us binding all of these resource guides that may or may not be up to date later on. So.
Nice. So I want to talk a little bit more about the workshop, because the fact that you guys developed all of this before COVID, obviously you talked about how you guys had to tweak it and stuff like that. Do you find that the online workshops and the people obviously had to attend virtually, do you find that they were still able to get their need met by attending the workshop?
Yes and no. So, yes, because I think a lot of people are finding out about resources they didn't know about.
Yeah.
And especially like now that folks are stressed. And actually the second workshop that we did, we had someone ask us, do you have COVID resources?
Oh,
and
wow.
we were like, no, we didn't make a COVID page. And so our agency, Cal Voices, I had made a COVID page on that website.
Yeah.
And then, and so we basically like linked our SacMap page to our COVID page. So now we have a link on our SacMap page for COVID resources. And we tried to find mental health resources related to COVID.
Yeah. Wow.
So if you go onto our SacMap page, then you click on that, it'll take you there, and then you'll find some resources as well as some support groups that we're doing for COVID. And then we have a lot of articles around mental health and COVID. So that need came up that we didn't really anticipate in the beginning. And then I will say the difficulty with doing it virtually is that there are some people who cannot participate. Mm-hmm. And it's not for the reasons people think.
Yeah.
People aren't able to participate because sometimes people have the free government phone.
Yeah.
And they can't get the Zoom app on there because they have too many apps.
Yeah.
Or I don't want to say too many apps. They don't have enough room for an unlimited number of apps, right? So there are folks who aren't able to participate because they are like, I don't have a computer and I can't get Zoom on my phone. So that's been a challenge. We encourage people to call in, but it's not the same experience as being able to like see the site and kind of like walk along with everybody else through the workshop. So I think that is a gap that's out there. And so we are trying to, at some point, we're going to record the workshops and we're going to post kind of like a more generic one on the website so that people don't have to necessarily go into a Zoom meeting. They can kind of just go on there and watch a recorded one.
That's awesome. It's definitely not the same, obviously being in person, opposed to online, but at least, you are getting something,
Yeah.
I know when I first started like working from home, I was like, man, because I was used to that in-person contact, that connection, and working from home, it's just different. It's different. Yeah. But I think COVID has caused the workforce to be very creative, to be very resilient, and the work continued and it just went on.
Yeah.
So especially with Cal Voice, I'm really impressed with how Susan, was able to all you guys able to kind of get this stuff up and going, and it didn't slow you guys down at all. It was just we got to keep marching forward.
Yeah.
So I'm really glad of that. So how long do you think this program will be available?
So right now we are funded through May of 22.
Okay.
So that's a little over 6 months.
Yeah.
And we're working really hard to try to get funding to sustain the project going forward. So even if we had to scale it down, we want to make sure that we keep the website going. We're keeping it updated. We're keeping the translations up to date. We really need, so after that, we really need to be able to fund a staff person to be able to keep all of that information up and going. We would love to keep doing the workshops, but again, it's trying to secure the funding. And I think what's most important is making sure those resources are still there, visible, the community can utilize it.
Yeah. But I know a lot of times, Steph, I know you guys do good work because I'm part of what's going on, but do you sense that there's a chance that it may be an extension or...
I don't know because we're funded through a one-time funding grant.
Okay.
So we're doing what we can to try to sustain it, and I think that's why we worked with a web developer to do the filtering tools. That's why we really did this online.
Yeah.
Because we want to keep it going as long as we can and not kind of get stuck to kind of like the printable format, things that there's a cost to get it printed. There's obviously going to be cost to keep things updated, but we're really trying to do what we can to keep costs low so that once our funding goes up, that we're able to sustain it at least, at some point.
I know the agency is always looking for grant opportunities to be able to continue the work that they're doing. Anything else that may be something close similar to this, just in case this funding may be cut, or just...
I don't know. I mean, I think that overall our agency is really committed to this work. So I think kind of doing what we can, utilizing our volunteers, like doing what we can to keep it going. I know that it's for us, especially with the personal experience that we all have, like actually being affected by the system, we know how valuable this is, and we don't want to be like, oh, we're not going to do this anymore because we don't have the money to do it. It's like, can we be creative in finding ways to kind of keep this going, because it has become, even within the short time it's been in existence, it's become a very valuable resource for our community members, for our providers. I mean, we have provider workshops where we have providers coming on and using the tool to help their clients. That's right? Awesome. And we're really working with them to try to like use this as a way to empower the folks that you're supporting and teaching them how to look for resources. How do they decide which resource that they want to use, right? How do they figure out, well, I really like this program, how am I going to get there? And having those conversations and helping them, not only to feel empowered, but to start to build their independence, build kind of skills that they're going to use, not just in getting a service, but in their whole life. And so, I mean, I think for us, this work goes beyond just kind of like the so specific mental health stuff, but really like there's so much opportunities for, skill building and things like that with our providers. Wow.
Nice. I know, years ago I went to the doctor's appointment, with my friend, and, I was talking to his doctor about, mental health matters, 'cause I'm trying to recruit, a guest. And so he was so he was just so interested in what I was saying. And he was like, well, just give me a little bit. I took down his number and blah, blah, blah. And I tried to reach out to him, but he was too busy. And then maybe after like 2 months, he reached out to me and he was like, now I'm ready. Because he was explaining to me that I guess he had another doctor who was a psychiatrist, who had been in his ear and trying to educate him, because a lot of his clients that was coming in, they were having mental health challenges and they needed resources. And so he started educating himself like he was, we didn't get to do the interview though, because something happened where he ended up going on vacation but he was like really like wanting to educate himself more about that so that he can be a better provider to his clients that come in. And to him, it's all about having these resources.
Yeah, I think it's really important, because if we look at recovery and talk about recovery, there are many pathways to recovery.
Yes.
It's not one pathway. It's not one service.
Yes.
And so when we're thinking about, somebody needs support for their mental health, it might, maybe they see a therapist or a clinician, but maybe they want to go to a support group. Maybe on the weekends or evenings, they want a number to call if they're feeling stressed and don't want to call their doctor.
Right.
Maybe they need a respite program to get away. Maybe they want to go to like a wellness center and hang out with some peers or some advocates, or do a support group, or, go to an art class for their mental health. So when we're thinking about mental health, it's not just like, oh, you have a mental health challenge, you go to this one service. Right. You could have a package of resources and services and supports that are available to you, and recognizing that like this is not a one size fits all approach, right? We hear that all the time. Like different things work for different people. And so I think like the more resources that we can find available, then the more likely people are going to get help that fits their need, right? Not just, oh, we have this service, you have to fit within the service. And so I think that's something that we've worked really hard to do with SacMap, is what are all the resources available so that each person can find what really fits them, what feels safe, what is going to work for them, what is like culturally affirming for them. And so it's a work in progress. But I think it's something that can be really valuable for a lot of people.
Yes. Absolutely. So how do people access SacMaps? How do they get hold of you guys?
So the SacMap website, I'll throw it out there, I'll try to go slow. It's www.calvoices.org/SacMap.
Okay.
And so it's part of our Cal Voices page. So even if you only went to calvoices.org, I think it's like in the little slider box on the top. And so that's where our website is. So that's where you can find all the resources and information. And then at the bottom of the main page, there's also a box people that can click on in order to sign up for a workshop. So we have those available monthly for the community members, and then every quarter we have them available for our providers. And then you can also sign up for our mailing list, so we'll make sure that you get all of our kind of workshop announcements and let you know about any events we have going on.
Yes, I absolutely love this, and I love the fact that you guys have something for the youth, especially the teenagers, with all the stuff that's going on out here. It's good that obviously, a lot of youth, they are definitely, social media friendly.
Yeah.
They love being on there, but also they have their own challenges and struggles. So it's good that they can find a space or a place to go to on this website and get the resources and some assistance that they need. Because a lot of times people don't, feel comfortable just telling the next person, look, I'm depressed, or I'm having a hard time. Because sometimes they want to hold up their image, or they may be scared or afraid, whatever the reason may be, but they can access these services and then just get the help, that they need. So to me, that's important, very important.
And even I knew that there were hotlines and crisis lines and warm lines and these youth crisis. There's all these lines you can call, right? But a lot of them now have a text feature.
Yes.
And I didn't know about that. And I think the text option is amazing because a lot of times we're not the only one living in our house. If we're young, we're living with our parents and our siblings, or you might have a roommate, or, you might live with your other family or your kids or your parents, or all this stuff is going on. And sometimes folks want to reach out for help, but if I get on the phone, they're going to hear me.
Yeah, exactly.
And now I'm starting to see these text options popping up where I could be texting with somebody about what I'm going through, and nobody's got to be all in my business.
Yes,
right.
Yes,
I have the privacy, so I think that's a really great option that folks now have available.
So are you? So is that an option with the SacMaps as well, or are you guys?
Not with SacMap because we don't really provide a service, right?
Okay.
So we have the website that's going to give you the information for all those services.
Correct. Okay.
And you know what? If you want to go to our workshop, but you're embarrassed or don't want someone to know, just tell them you're only going to get the $25 gift card.
Yeah.
And that's okay with me. I have no problem.
Yeah.
Right? I always say, however you get the message is fine with me.
Yeah, exactly. So talk a little bit about what's some of the information you guys actually talk about at the workshop.
Yeah. So the workshop, kind of how I mentioned, we talk about recovery.
Okay.
We give people statistics around mental health. We talk about recovery because I think that's something people don't talk about a lot, right? That things can and do get better for folks.
Yeah.
That this isn't a permanent place in someone's life, right? We're here for a certain time during a certain period in our life, but this isn't everything, right?
Yeah.
There is a vision for a different future.
Yeah.
So we talk about recovery. For our providers, we talk a lot about empowerment.
Okay.
Why is it important to empower our clients? Why is it important for folks to be able to have decision-making power?
Yeah.
How are we supporting the folks how are we supporting them in making decisions?
Okay.
How do we help people make decisions and build that self-efficacy to feel like they can make decisions in their life?
Yeah.
Because sometimes, even for us, personal responsibility can be a scary thing.
Yes.
If I'm the driver of my life, that means I'm now responsible for me. And that can be scary no matter what age you are.
Yeah.
Right. And so part of empowerment, part of building self-efficacy is giving people little opportunities to practice that.
Yeah.
And I think that's something that we talk about in our workshops with providers is how are we empowering them, and SacMap, the website, can be a great way to do that.
Yeah.
Right. We can start to show all of our folks we're supporting, here's all the resources available. Do you like any of them? Oh, what do you like? Let's go through the different ones. And we have some handouts on our website that providers or individuals can download and start to create their own lists.
Yeah.
But really, trying to just remind our providers of how great of a resource they can be to their clients, and not just affecting their mental health, but their decision-making outside of mental health,
yes,
right? Feeling
absolutely.
confident outside of mental health, learning how to navigate a website, right? There's a lot of things that we can be teaching them. And so, teaching ourselves really.
Yeah.
So I think that's, with the providers, that's something specifically we talk about. Then we go through the types of services. So folks understand if I go to the section, that's what this means.
Yeah.
That's what this service is. And then the tour. So we really want to show folks here's where you're going to find this information on the website. We don't have a ton of buttons because we are trying to make it as user-friendly as possible, but we try to give folks a tour so that when they go there, it's familiar, right? They don't get there and they're like, oh, I don't know where to click. And it's more like, oh yeah, I remember during the workshop, they clicked here and that's how I was able to find this service. So.
Yeah, I like that a lot because when I go to websites, I can be very impatient. I just want what I want, but then you do have to go to this page come up, and I'm like, you know what? I'm done.
Yeah.
So that's good that you guys was had that in mind when you guys was creating the website. You said something earlier that kind of caught my attention. You talked about how it can be a scary thing when somebody starts to take accountability for their life or their actions and stuff. I have a friend who he was struggling at one point with substance abuse and things like that, and I was, along with his family, was always a circle of support. I feel like sometimes there was a little enabling going on, but it was done out of love. And recently, he had went to a rehab in a whole other state. The program is a year, and he was in there maybe like for 3 or 4 months. He decided, like, okay, I'm ready, but I knew he wasn't. And I remember me and him talking on the phone because I was trying to talk him into going back to the rehab. He wanted me to send him somebody to go home with. He wasn't ready. But I remember him saying to me, this is the first time in my life that I have to take care of myself. Like, I have to be responsible, because he said, you've always been there, mom, dad, everybody's been there, but this is the first time, and he did say, in the beginning he was angry with me because he said, I didn't know where we stand. Like, you're like a brother to me. But I had to explain to him, because I love you, man. I want the best for you, but you have to make this work for yourself. You have to want this. And it was a realization that happened with him, like, oh, crap. Like, this is, and he told me, he said, Jay, I'm scared. And at that moment, it didn't, to be honest, it didn't register to me at that moment. Then I started thinking about it a little bit more, analyzing things. And I'm like, wow, this is scary for him, because he's living at home with his mom, and, they paying the bills, everything. Only thing he got to do is wake up, And now he has to, we put our foot down. He's having to deal with, realization now.
Well, and I think the scary part is also for the people who've been supporting him too.
Yes.
So it's
absolutely.
scary for him, right?
Yes.
Because now it's like, I've been used to having all the support. What if I make the wrong decision? What if something doesn't go well? What's going to happen? And then if you're the supporter, and I can speak to this one a lot, is that as the parent, as the family member, as the friend, as, all those people supporting them, we're scared too.
Yes.
What if something happens?
Yes.
What if something doesn't go right? Are they going to be okay? Are they going to make the right choice?
Yes.
What if they need something and they don't advocate for themselves in the right way? They don't get it. Like, all of these what ifs, right? And sometimes I think some of what you were speaking to is those what ifs get in the way of somebody being able to make their own decisions, to be independent, to grow, right?
Yes.
And it's because, as the supporter, I'm meeting my own needs.
Yeah.
Because I'm scared, because I'm nervous, because I'm worried. And so I don't want to feel this way. So let me control the situation, right?
Yeah.
But then we're taking that opportunity away for someone else to build those skills.
Yeah.
And I don't mean pull the rug out from under them. But thinking about, I mentioned self-efficacy earlier. How are we giving folks space to start to take those steps to do that, so that they don't feel abandoned, but they're also... We're creating a place of discomfort in the service of growth.
Yes.
Right? Where they're able to grow from that. And so the fear and being scared happens to everybody around them, right?
Yes.
But it's essential, because it's a opportunity for growth for folks. And I did that with my sibling.
Yeah.
I'd go to every appointment, I'd advocate for her, I'd call the people for her. And I remember one day somebody said, Steph, what if something happens to you? And I was like, oh, you're right.
Yeah.
So I told her, the next appointment you're going by yourself.
Yeah.
And she got upset, and I was like, I'm still going to take you.
Yeah.
But I want you to kind of go in and see how it goes by yourself, because what if something ever happens to me?
Exactly.
I want to know you can advocate for yourself. You can get your needs met. You can figure out how to get there. You can do those things. And so, and I remember she took a call one time, and I think it was with the outpatient, like a partial program. And I got on the phone because I was going to do the intake with them. And they go, no, we have to talk to her. And I'm like, what do you mean?
Yeah, exactly.
And they're like, we have to do the assessment with her. And I was like, okay.
Yeah.
So I put her on the phone, and she did great.
Oh, nice.
And so it was like, now I'm in the realm of prove me wrong.
Yeah.
Like, that's what but that was also an area of growth for me.
Yeah.
Right? To be able to let people, I need to let go of that control.
Yeah.
And so I think that fear is really, it's there for everybody.
Yes.
And it's how are we creating a space, a safe space, a supportive space for folks to be able to start to take control over their own lives.
Yes. Everything you said about the support of being fearful, all those emotions was going through my mind. Every last one of them. because he's in a whole nother state. He's never been in a situation like that. He's always had somebody there for him, and he actually stayed out on the street, and that was so hard for me. Like me and two of the sisters, I can tell we almost just gave in and sent the money to come home with. But I'm so glad I didn't, because if I would have, he would be in the same situation he was. So thank God I stuck my ground. But it was so hard to just see him out on the street and knowing I can help him, to get back. But I'm glad I stood my ground.
I think something that a lot of people talk about is readiness.
Yeah.
Are they ready?
Yeah.
Right. And Dr. Mark Reagans, I don't know if folks are familiar with him. He's a retired mental health professional as well, and he talks about readiness. Like, is anybody ever ready for anything?
Yeah.
And some of the things he says, like, were you ready to have a baby?
Yeah.
You probably weren't ready, but if you didn't try it, you wouldn't have one right now.
Yeah.
Were you ready to drive a car?
Yeah.
And he goes, no, but they give you a permit. They give you a license to figure it out. And so he gives a lot of other examples I can't say on TV.
Yeah.
But he goes back to saying, but are you ready to bumble?
Yeah.
Are you excited?
Yeah.
And that's where it's not about being ready.
Yeah.
It's like, are you excited? Are you ready to get out there and try it? Like, that's what we're looking for.
Yeah.
Right. And so it's not always readiness. It's, are you ready to bumble?
Yeah. Well, Steph, this has been a very enjoyable conversation. I always love talking to you, but we've run out of time.
Well, thank you for having me. I appreciate it. I know we could talk all day.
I know. Oh, you'll get a chance to come back. You will, for sure, Joanne. And that's it for this edition of Mental Health Matters. If you enjoyed this particular show, if you would like to be a guest on our show, or if you would like a DVD copy of our show, please dial 916-366-4600. Thank you.